June is a 100-year-old female who was admitted 3 days ago to our rehab facility from the hospital. She recently had a fall that fractured her right superior pelvis. Her pelvic pain is well managed, and she's able to transfer from her bed to her wheelchair with assistance and can walk with assistance during physical therapy. Today, she complains of sharp pain on her anterior left lower extremity with palpation. She rates the pain a 6 out of 10 and states that it only occurs when the leg is touched. She has full range of motion in her leg and ankle, and she also denies pain with movement of the leg. I noted swelling to both lower extremities, and they're equal. There's no redness, warmth, or bruising on her left lower leg, and pedal pulses in both legs are 2+. She denies numbness, tingling, or weakness in the extremities. My main differentials for her include a DVT and a fracture of the tibia or fibula. DVT is higher up on my list of differentials, mainly because she had a recent pelvic fracture, which is already going to put her at higher risk for developing a DVT. Right now, she's less mobile and she's more sedentary just due to her nature of her injury, and she has unilateral leg tenderness. She's not on any anticoagulants, but she does take a baby aspirin every day. But there's no redness, warmth, or unilateral edema that are clinical features of a DVT. For the fracture of the tibia and fibula, it's lower on my list, mainly because there's no signs of bruising and she can tolerate weight bearing on the extremity when she does walk with physical therapy. However, she may have injured it during the initial injury, and so it should still be considered. So some questions I had asked my preceptor include, are there any other pertinent signs in the older adult population that may indicate a DVT? And why wouldn't this patient be placed on an anticoagulant therapy just to reduce the risk of a DVT from occurring following the fracture of her pelvis? So my plan is to obtain a Doppler ultrasound of the left lower extremity and also get an x-ray of the tibia and fibula of the left lower extremity. I'd also recommend that she wear some compression stockings just because she had some decent dependent edema in both of her legs, and just encourage her to elevate the lower extremities. And maybe we can work with physical therapy to teach her how to do some activities with her legs that are not weight bearing, just so she can get them moving and get the blood flowing. Just because her ability to walk around and move her legs is a little bit limited with her injury. For self-directed learning, I just want to learn more about what are some less overt signs of DVT in the older adults and how I can kind of come to that conclusion, even if the signs aren't clear as day.